I
Okay.
don't know the word.
Well, what do you want to talk about? Like, I guess my question to you would be like, why do you hate me?
I don't hate you. My,
Okay.
my whole show is just designed about, if I hear lines of thought or particular rhetoric and I, kind of want to go after them, I think that they can be criticized.
Some
So,
of your mods hate me.
yeah, they probably do.
Yeah.
Um,
You got to get rid of that. What's that guy's name?
that doesn't narrow it down for me, unless
Uh,
that's his
starts with
username.
starts
And
with
if
D.
oh,
Whatever his
Michael,
name is.
it's probably Michael Deaton.
Oh,
Yeah,
Deaton. Yeah.
he's been a mod for he's been a mod for my channel
He's
for a
not
while.
well
Yeah.
in the head, is he?
Well, he gets quite passionate. So
Yeah, but
I,
to me, that's a
I
sign like something's not clicking. And like when you get so emotional about things, um, I don't know. Anyhow,
yeah, and
these.
I don't know how much of some of that is trolling on his part too. So yeah, I'm not
No, I
sure.
don't think because he's been on my channel like in the comment section, and he just
Oh,
you can tell right away. And this is why I blocked him. He just like the vitriol, the hate, the emotion is just. I don't know if he was abused as a kid or what, but something's not right.
I don't know yeah. I mean, I don't mind emotion or passion. If it's getting vitriolic though, yeah, then usually he did get into an issue, I think, with another mod, I think, on my channel.
Oh yeah, yeah. Another mod on your channel. There's
With
what
somebody
I
else who had mods, yeah. Most of my mods, I don't have very many, but most of the people that have mods have just been sort of people that I've known, but they don't have that much kind of authority over the
I hate those
show. I mean,
channels where like almost what 70% of people commenting are mods. Like whoa, no, make people feel earn it. People like if you're a content creator, you should have like 1%, 5% mods, and if someone wants to be a mod, they have to earn it.
there was some other things too because some of the initially when I started, depending on who I was having conversations with, they would join and come in, but because they had a bunch of people blocked, they couldn't comment anymore or something like that. So some mods were given to people just to make sure that they couldn't be, kind of excluded. So,
But where's my
which
manners for the people in live stream chat? This is Jefferson Spatchcock, and he has his own channel named, you guessed it, Jefferson Spatchcock, and he has reviewed a couple of videos I've done on my political channel.
compared to Rush, oh, and
Compared me to
fun.
Rush Limbaugh. I thank you for that. And yeah, that's probably good enough. That's not your real name, right? Or
No,
no, it's from
my real first name is Jeff, but yeah, there's no way that's my last name. That's
Spatchcock comes from a movie.
it comes from a cooking term. It's butterflying, like if you butterfly a turkey or butterfly a chicken. That's called spatchcock.
I never knew that. What you butterfly a chicken?
Yeah, so you take the whole bird, you flip it over, you cut the backbone out, you flip it back over, you splay it out and snap the sternum, so it spreads it out. That's called it's butterflied or spatchcock.
Spatchcocked or cock?
Spatchcocked, I think, is that if you're doing a past
Oh, so
tense
you should
verb.
really have an ed at the end of that.
Well, no, because I haven't been that. I am that.
Oh, oh. Is your goal to do that to other people?
I didn't want to put in ed because then people might be like, "Why is your last name a past tense verb?" Maybe that would be less offensive because with this particular username, I was not able to get a Twitch account. They found it offensive. So like
Oh,
it's a
okay.
it's a butcher term. Like they're like, no, no.
I listened. I don't know when it was to your channel, and you said that there were some things you agreed with me on.
Yeah, occasionally there are. I mean,
What?
generally, I don't think that there's too much I disagree with you on when you're doing counter apologetics.
But
Maybe here and
on
there.
politics, is there anything you agree with me on?
Um, well, I remember the video that you did a while ago where you were doing the one of those political compass tests, the ideology tests. And
Hmm.
I remember some of your answers were kind of close I mean, they weren't super close, but they weren't ones I disagreed with per se. I mean, some of those questions can be kind of broad, but because, and I think the results that you came up with, I think you were like labeled a centrist, a liberal centrist or something like that was the
Yeah,
result.
I thought
So,
I barfed. I mean,
I mean, and I don't think you're not one of these guys politically that believes in like, kind of they call them like the anarcho-capitalist types that want to just like remove any and all social welfare at all,
yeah,
no
no, I'm not.
taxes. Yeah. So I think in that case, that's a point of agreement. But
I do think we should feed the unemployed to the elderly,
I don't think the unemployed. I don't think the elderly would appreciate that. I mean, I
or
think
feed
they
the elderly to the unemployed. I don't know. One of those I
uh,
think can work.
they'll just give the unemployed strength. I don't. And then you end up getting this group of people in the hinterland that are now fueled by cannibalism. That just leads to Thunderdome. I think
Yeah.
that's not good.
So you don't quite remember exactly what we agree on politically, but you just remember some of the things I answered on that test was similar to yours.
Or at least close to it. Yeah, I wouldn't say that. Yeah, I can't say that I disagree with you completely, but I do disagree with you on kind of like characterizing woke and
Ah,
some of the
yes.
LGBTQ stuff that's popped up, mostly the trans stuff, just because some of the rhetoric that I hear, and I watched the conversation that you had when you called into,
The line.
yeah, the transatlantic,
What'd you think
yeah.
of that?
I, I thought it was okay, but you guys were talking past each other almost from the very beginning.
Yep.
Mostly when you phrased it as, I think the thing that we can agree on is our concern for children, or something. You worded it something like that, but
Yeah.
that actually you can't agree on that because I'll ask you this: what do you think motivates their concern about that issue? If you guys are talking about,
Real relationships they have with people who are trans who are hurting. That's what motivates them.
okay, but specifically, if you're bringing up like kids, so you're talking, I think, because I think you guys kind of like narrowed it down to trans, like gender affirming care for minors, right?
Yeah, I would give the same answer because I wouldn't doubt that some of them might know people like that. But more broadly, it's an identity issue. So if you, or a fairness issue, that if you don't allow this, if you exclude, if you discriminate against trans women in sports, you're kind of discriminating against the whole tribe. And you can't do that because it hurts them.
Mm, I don't know if that's really where they were coming from. If you don't mind me laying it, well, actually, let me ask you this follow up. What motivates for the purposes of the discussion you were having with them? What motivates your concern for kids? What's your chief concern?
Because I have kids, so
No, but
I can empathize. I can see.
no, that's how you do it. What is it? What is your concern about trans care and minors?
Oh, that they cannot consent. Number one, the kids are often confused and crazy. Number two, that there is a regret rate, and we can argue about what it is. And so, if you do something that's potentially irreversible, that's not good. If they regret it later,
Okay.
and I think Ben and I agreed on that.
Yeah, I think that matches most, especially when it comes to something like bottom surgery or something like that.
What I found interesting, he said that, and I agreed with him, that teenagers cannot consent. They're not of the age of consent for bottom surgery.
Right. Yeah, they can.
Then I wish I could have talked more, but I couldn't. I had to be so careful. But I would ask them, but they can consent to top surgery before 18?
That is very limited.
No, but
The
what would he have said to that? Can a teenager consent to top surgery before 18?
On their own, I don't think so. I think they can consent to it with joint consent of multiple care providers and their parents. I think that's the only way that works. And even then, I don't know of any top surgery that's ever been performed. And I could be wrong about this. I don't know if there's been top surgery performed on a minor below the age of 16. Um, and the unusual thing about that is that I do know of top surgeries that have been performed by non-trans minors, girls, to have breast reductions. If they had, overly large breasts and it was causing physiological problems, they were able to have, breast reduction stuff. But like as far as like a total mastectomy, I don't know.
But this whole idea of consent, like what does it really mean if we're talking about joint consent and not just individual consent? What are we
Well,
even
I
talking
mean, if
about?
the well, because the idea is, stage one of the entire process is usually kid questioning their gender, and then they go out. If they have the means or the access, the resources, then hopefully they get to see a therapist or something like that and talk with them. They can't at any point, I think, demand Like, and that's where I think the narrative gets messed up, especially in some right wing circuits, because it seems to me that the implication is there are doctors out there that want to transition kids before the kid's ready. And I haven't seen any evidence that, I mean, even just speaking for my own doctors, I I have a few health conditions myself. They're pretty common for a man my age. If my doctor had her way, I would not take the medications that I take, you know, because she'd rather I be healthy and happy without any medicine at all. So the idea that doctors are sort of motivated to provide go way overboard and decide, oh, well, this kid's feeling a little distressed about their gender, HRT and surgery right away, and you'll feel right as rain. Like, no, that's not really it. Most of them are still very cautious
But
about
would
it.
you
So,
support legislation that says thou shalt not have any bottom surgery for kids before the age of 18? Would you support that type of legislation?
only if doctors did.
Uh,
It
uh,
would.
well, what Ben said is there's no evidence that shows that the benefits outweigh the risks.
Right, but the reason that I don't like those kinds of if you pass legislation like that, it's usually ends up getting turned into something like the legislation against abortion. So for years with sort of the anti-abortion crowd, the idea was to argue against elective abortion. And then they would say, oh, well, you know what? If we're interested in passing any kind of bans, it's just on women having an elective abortion, terminating a pregnancy just because it's inconvenient or something. These other situations with rape and incest, assault, whatever, that of course that we're not gonna do that.
So you would be
That's a
against any legislation that would ban bottom surgery for kids?
yeah, I might be, because I don't think that would be necessary beyond, because the medicine's not even there yet. The medicine's not trying to push that. In fact, the medicine's pushing the opposite. But they're like, no, you can't have bottom surgery until you're 18. You're old enough to
Would you be
consent to this. You've
against
been through
a,
therapy.
a law banning getting tattoos for kids?
Would I be against it?
Yeah. Would you support a law that says kids under the age of 18, it's a crime for kids under the age of 18 to get a tattoo, and that the person who gives the tattoo can be fined and punished, and maybe even the kid?
I mean, probably. I mean, I probably would not be for that legislation. No.
Hmm.
If a kid wanted to get a tattoo, I mean, the only time I can think of a tattoo being an issue for a kid is if a kid doesn't understand that, there's a white blood cell buildup having a tattoo, and maybe they've got an autoimmune
Because
issue
isn't it
going on.
against the
They
law
shouldn't
to
have it.
get a tattoo below 18?
Depends. It depends on the state. I know in some states, in fact, I think Kentucky, with a parent's permission, a 13-year-old can get a tattoo. I think 12 or 13. So it just depends on the state.
So the states that do have that restriction, you wouldn't support that particular legislation?
Restricting their age.
Restricting getting a tattoo. You cannot get a tattoo before the age of 18. You would say, no, that shouldn't be a law.
Yeah, I don't really see why that would need to be legislation.
Okay.
Yeah.
How about a kid who wants to get, I don't know, a finger chopped off?
Just so now you're talking about like kind of transhumanism stuff, like, oh, I want to get
Yeah, that they
my hand replaced with a hook kind of thing.
that, or even like they just feel better if their left pinky was gone. Should there be legislation that says that you cannot chop off body
You can't.
parts?
There might actually be laws against self-mutilation in some states. I don't know. I
No,
don't
but
think that
it's not self-mutilation. They hire a doctor to do it. Let's say.
what doctor is going to do it?
Let's say a doctor thinks that for their mental well-being, if I chop off the finger, their depression will go down and their risk of suicide will go down.
Right. Well, it would depend on why that was, right? You wouldn't jump to that first. If you've got a kid that's like, hey, I think, doc, that if I rip this finger off or have it lopped off, maybe you could cut it off, I'll feel better. And the doc's going to be like, why? Remember, the doc medically is not going to want to jump to just whatever the patient says. It's not, it's not the same as going and buying a steak. They're probably going to be like, look, you've got something going on. We'll talk about this in 18 months after you've had some therapy to talk about why your pinky finger is haunting you.
But you would not support a law that says doctors cannot chop off fingers of teenagers?
just to put a law in there. I don't think I think that's an absurd example, but
Oh
the
yeah,
medicine wouldn't go there, right? You already have malpractice things for that. So um, it would basically be the same thing as saying, "Hey, docs, don't reach for the knife when you can send them to a shrink."
yeah,
If say, they
I
were going
agree.
to, right? That's usually established in rules of care, and it's often established for. You wouldn't even need legislation for that, because that would be, you'd be talking about making it criminal, depending on the state that doc's licensed in. If they tried to do that, oh well, the kid told me that they wanted their pinky removed, and I did it. The patient's always right. He's losing his license, so because that's not the standard for care established by the medical board of that state. And they're like, nope, he goes before a board, he loses his license. That's it. He didn't have to even be charged with a crime. It's not even technically illegal, but is that doc going to practice medicine again? Not in that state.
So it looks like we're agreed that for bottom surgery, we should not, kids shouldn't be doing it because the evidence is not there that it helps, right? We're agreed on that.
It seems to be too far. Yeah.
Yeah.
Medically and scientifically.
But
So.
where we disagree is there shouldn't be legislations to prevent it from happening.
No, because I think that most of the stuff that I've seen in terms of, say, trying to ban gender affirming care, it's not specific. There isn't one coming out and saying,
But if it were
okay,
specific, would you support it?
I would be more inclined to support it if it was.
Okay, so maybe we're not that far apart.
But at the same time, it wouldn't be any different than it was now if it said we're banning the bottom surgery for anyone under the age of 18, regardless of what the patient wants and their parents want, or guardians and their doctors want. I would not support that kind of legislation, because then you're taking it outside of the realm of the doctors. If it's just a blanket ban and like the doctors have no say on this, no kid gets that treatment, I don't really agree with that. But to say like, okay, we were going to pass a law that says you as a patient can't go and tell your doctor, I insist on bottom surgery, I'm 15 years old, the doctor can be like, no, that's not how medicine works, and there's actually a law against that. In that case, sure, you could do that. But I think it would also be a waste of time as legislation.
Yeah. Do you think doctors have a good success rate on, let's say, even diagnosing trans?
Depends on the doctors. If they're DOs or MDs, very likely not. If they're primary care, most there, you could always have a DO or a DO or MD that's in primary care, family medical practice, something like that, and they get a situation where they got a minor coming to them with their parents, like, yep, they're questioning their gender, they want to go the opposite way, what do we do? The doc might be close to as confused as the parent is, but the guidelines would be, what you'd need to do is take them to see a therapist that specializes in this, and have them deal with this to find out what's really going on in the kid's head. And then it's up to an expert to deal with that patient, get to know them, figure out what's really going inside, and to determine whether is this an identity thing.
That's the challenge, to figure out what's really going on inside, right?
Right, but an MD or a DO is not going to be probably
Right.
not going to be.
But I'm questioning whether a psychologist could even do it.
Well, it depends on the evidence of it, right? And that's
yes. What's the evidence for transgender?
It seems to work.
No. What's the evidence that someone is transgender?
Based on like what? Like a diagnosis?
I'm asking, if someone, let's say I had 10 people and I brought them to a specialist in being transgender, but only one of them is really a transgender, and I paid nine actors.
What does that mean by really transgender? Do you mean actually
let's
suffering
say
from body?
let's say a God exists, and this either a mismatch between what they identify as and their sex, however you want to define transgender, but that's usually something like that. So we have 10 people, and I pay 9 of them to be actors, and one is real transgender. Do you think a psychologist, and we train them, you train the actors, backstory and everything, do you think the doctor could figure out which is the real one, which are out of the 10?
Yeah.
Would you be willing to place money on it?
Yeah.
We should do it.
Unless
should do it.
Unless you find a really, you find like a clueless doctor that's just doped to the gills or something. No,
I would love if a billionaire was out there listening and set up this experiment.
Well, but
this could be potentially devastating to this field.
Before the bet went forward, though, the issue is you'd have to figure out what it is you're talking about, because If you're talking about self-identification kind of trans thing, then a person is trans by kind of declaring themselves the gender that they identify with. If you're talking about doctors diagnosing dysphoria, you don't have to be dysphoric to be trans.
Right.
So it depends on, what these individuals are going for. So
Right.
part of it is not about a diagnosis per se. It's about finding out, basically taking the patient through some kind of a lot of self-reflection and a lot of consideration to figure out if this is something that they want to do.
Do you think if we had, let's say, 10 psychiatrists or psychologists, I don't know who specializes in this, and 5 of them were hardcore Republicans, 5 of them were hardcore Democrats, and we bring in a person who identifies as trans, do you think, this is the first meeting, do you think that the 5 Republicans and 5 Democrats will come to the same conclusion on this one individual trans person who claims to be trans?
You're talking about their medical opinions.
Medical, yeah.
Yeah, they probably will. It'll probably be pretty similar. Like, let's say that you had again, it depends on the stage and the doctors. Let's say you've got 10 primary care physicians and you present a minor that's saying, hey, I identify as a gender opposite of my sex. I'm a boy, but everybody calls me a boy, but I want to be a girl. 10 doctors, 5 Dems, 5 Republicans. They look at that kind of situation. They're probably going to come up with very similar recommendations in terms of the parameters of their medical view. I don't know how many of them, like if you try to get into like a specific state, because this would be the slippery slope. Well, we've got 5 Dem shrinks and 5 Republican shrinks, and the Dems just want to coddle these people and let them put on dresses, and the Republicans want to send them out to be publicly paddled. That absolutely will not happen. That won't happen if either one respects their medical degree and their license and their continued ability to practice medicine. They're not going to go that way either. So yeah, most of them, I think, operating within professional parameters are probably going to reach similar professional opinions unless they go out on a limb.
So you think that whether you're a Republican, a hardcore Democrat, they would both come to the conclusion patient A needs hormone or puberty blockers or whatever. They would come up with that same type of conclusion.
They could. But I mean, it's obviously going to vary. One of them might be like patient may benefit from beginning HRT, and the other one's patient would definitely benefit from extended therapy. But it would be interesting to see how many of them out of them would be like, this patient needs to be denied gender affirming care altogether because it's just no good, and it's a plot to practice a wave of medical malpractice against kids to make them woke and gay.
I agree.
That's the thing that's the narrative that I have a problem with.
I agree with you, but you in principle that they could come to the same conclusion. But tell me if you agree with this. If we were to take 10 oncologists, 5 hardcore Republican, 5 hardcore liberal Democrats, and the illness is stage 4 lung cancer, and I asked the exact same question, do you think these 10 oncologists would come to the same conclusion after they've done their biopsies, CT scans, everything? This person has stage 4 lung cancer. I would say that the confidence levels in that situation is way, way, way higher than the confidence level of someone saying, I was born a boy, but I'm a girl, and we got this 10 doctors. Would you agree with that? That with one, we have way more confidence than with the other?
Right, because one is based on some kind of disease that affects a much greater. First of all, it's a disease. It's not a psychological issue, condition, or social construct like gender is. And the other issue is that that is a very small population versus people that have suffered from cancer, which is a massive population. So, yeah, them being able to come up with a consistent prognosis in cancer, yeah, definitely. But that's literally apples and oranges. Those are 2 totally different kinds of conditions.
We got patients and doctors,
and the other one is
who need treatment. That's how they're the same.
Right, but what you're comparing is one is a terminal disease that affects lots of people, and we have lots of history and lots of evidence and lots of research on that. So there's a huge amount of research to draw from diagnosis to prognosis. With the trans community, you probably don't have as much reliable research because of,
Whoa, say that again. We don't have as much reliable research.
we may not. I don't
What do
know
you believe
to
we
the
do?
extent. I believe we do in some cases, especially in regards to treatment, but in terms
What
of
do you
like
mean in regards to treatment? Because that's what we're talking about.
psychological therapy,
I,
psychological
I
therapy
know.
or hormonal
So we either
hormonal
do
therapy.
have reliable research or we don't have reliable research on treatment. Which do you believe?
We do, but we don't have it to the same extent that we have on, say, cancer, which is a massive disease that
So,
affects
but if it's
far more people.
reliable, who cares if it's like 10% of the cancer one? It's reliable research.
I don't understand what you. I feel like you're trying to like set this up
You're
into
saying
something that
in
it's not.
quantity, there's more cancer, right? In
There's
quantity,
more research. Yeah, so it's basically just induction. You get more and more cases. You have more and more outliers that you can draw
but with
from.
the trans, you're saying it's not as frequent, but it's still reliable.
Well, you do have a smaller population, but you could still have reliable research in terms of the care that we
You
have
could or
now.
we do. What do you
I
believe?
think I think that we do. I think
We
it's
do.
getting better, but it
So
depends
then
on how
what's
many
the
people
issue
you
with
treat.
the size? If it's reliable, if you believe it's reliable, then it's reliable.
Because if you're trying to like I said, you're comparing two things that are totally different. One is a disease that affects an enormous amount of people, and the other one is a condition that affects a small group of people. So they're
Okay.
not the same thing. One isn't necessarily based on a
I agree.
prognosis. You're not
They're not
saying
the
you're
same
going to die.
thing.
You're
But
not
what's
going to get diagnosed as, yeah, you're trans and it's terminal. That no doctor is going to say
I
that.
know.
It's categorically different.
Well, some people might say never mind. I won't go there.
Right wingers would, yeah.
But I agree with you that they're different. They are similar, but they're also very different. And I think maybe we agree on why they're different. One is basically an internal mental thing, right?
Possibly,
That cannot be verified with a machine. Do you agree?
possibly,
Possibly.
right, possibly.
So
I'm,
far,
I mean, neuroscience is just, I mean, is in its infancy. The amount of stuff we don't know about the brain is, I mean, vast compared to what we do kind of understand about it. And a lot of the new stuff that we understand about it is really overturning the things that everybody just kind of took for granted. Like
right?
the
But as it sits
concept of like
today,
a lizard brain
can we verify someone's transgender with a machine?
with a machine. No, not with a machine.
No.
No,
So how do we know if someone's really transgender?
you listen to them.
By talking.
Yeah.
This is why the confidence level, in my opinion, should be way lower with the
Why?
because
Can't you tell? Can't you tell by talking to people even and not even for 2 years? Because oftentimes that's what's on the table. If a person is saying that they're trans and they're going to their doctor for it, they're looking at 18 months to 2 years, sometimes 2 years minimum, of some kind of psychotherapy. How many people have you spoken with that maybe you thought weren't quite and totally on the level, and you had a pretty good idea in your semi-professional opinion as a counter
I'm not
apologist,
saying talking is useless, but I'm saying it's not as
right?
reliable as a machine because it's less objective and more subjective. Would you agree with that?
Yeah, but
So
why would
whether
that?
you're a
That would
Muslim,
make.
a Jew, a
But
liberal,
why?
or a
Let me ask you,
conservative,
why would that make it unreliable given that this is a condition, not a disease? You're not talking to somebody to find out if they've got a tumor. You're talking to them to find out
right?
whether or not they identify as a particular gender.
Right.
So why would that matter?
Why would that matter? Because
Yeah.
of where it might lead
Where might it lead?
with treatment.
Okay. But what's the harm in any of the treatment?
What's the harm
Yeah.
with the treatment?
Yeah. What's the fear here? Because this seems like this is where I think you guys were talking past each other on the transatlantic. It seems to me that like when you guys were having the conversation, Ben and Arden's primary concern is we got a minor that's expressing gender nonconformity. We want to make sure that that kid
Okay, I'll
has
tell you what
access
the
to
harm
care.
is.
Yours seems to be we got a kid that's gender nonconforming. I want to make sure some doctor doesn't get their hands on him, start chopping into him. Is that what's motivating you? That the
Uh,
medicine is bad?
yeah, it's if you're incorrect in your diagnosis, if there's
Hmm.
regret at much higher rates than we think, even if it's less than 1%, if there's any type of regret, if it's irreversible,
At which point?
like let's say a hysterectomy is irreversible.
Right, but what about okay, so the first step is
So you
therapy,
ask
the
me, what
second
is the harm
right.
in the treatment? I'm giving you the harm in the treatment.
But you seem to be
Performing,
jumping to the extreme end.
yes, you start there and then you can work backwards to more middle stuff.
Okay, so what would
So,
be the harm in them, say,
so,
getting puberty blockers?
so do you agree that that is harm to take a uterus out of a 16-year-old girl who's not transgender?
Not necessarily. If the child, if they have uterine cancer,
No, they don't have uterine cancer. They're taking
should
it
just
out for the reason, and you can even say this never ever exists. We're thinking
right.
hypothetically right
And
now,
so far, I
okay?
don't think it does.
Okay.
But you see what you're doing here. You're going to an extreme example. I want to
Yes,
know,
on
like,
purpose.
what's wrong with the puberty blockers? Let's start with scare tactic number one. What? Because I understand
Why
that if
don't you want to talk about the uterus?
we might as well be talking about breasts too. If you've got a surgery, even a top surgery, and a child has either her breast removed or has breasts added or something like this, and they come to regret it, that's a major deal. You don't even have to talk about bottom
Okay, so you agree there
surgery.
is harm in that.
There could be for them, especially if they regret it.
Yeah.
But the issue is, before they ever got to this point, anything that's going on in their transitions, their first is therapy, which they may regret or they may not reversible. Second might be puberty blockers, and that's usually to extend the time that they have for therapy and before they have an onset of secondary sex characteristics that might make them more anxious if they're dysphoric. So puberty blockers might be a thing, also reversible. Thirdly, if they do go through these things and they
Wait,
do
hang on.
commit
Puberty blockers are reversible?
they're reversible.
Like
Yeah,
all the effects of puberty blockers are reversible?
to the best of my knowledge, yeah. I know that there's a concern about like potential bone loss, but most of the studies that have come out saying, "Oh, well, you're just going to have osteoporosis early onset for the rest of your life," I don't think that's been established. I think that's an overblown
Is the
concern,
default
and that's
position
the
you
only one that
try it until proven otherwise, or you wait until it's proven safe? Where's your default?
my default is in the care that the doctor's providing. If they believe therapy is enough, that's as far as they go. If they need puberty blockers because they're dealing with somebody who's dealing with a lot of mental incongruity about their sex versus gender, it's causing anxiety, maybe puberty blockers are recommended to give them more time to deal with the therapy. And then if they get weaned off it, they get turned off that and things they don't go that way, that's it. Now, if they do advance to the next step and they decide to do hormone replacement therapy, that'd be step number three. And this, I'm grossly oversimplifying this in my layman's understanding of this, but all that stuff would be happening before surgery would start happening. And at most, if you're dealing with a minor, you might be dealing with like a situation where a crew of doctors believes that this particular individual would be better off if they had top surgery at the age of like 17. Maybe it would depend on the doctors. I wouldn't really weigh in on that. I'm not a doctor. I haven't seen trans people as patients in that case. But I wouldn't want to make a law telling doctors that they can't make that recommendation, especially if multiple agree that that might be the best thing for that patient. So, what I don't understand in your case is it's easy for you to present the example like, well, what if a doctor removes a hysterectomy from a 16-year-old girl and they fucked up? That would be terrible. You might be talking
We
about
agree.
malpractice. That's malpractice. But that's not the standard of care. That it
I never said
and
it
this
was,
right, but then why even have the discussion with
because
anybody
now we
who's
can work
talking about
backwards.
okay,
So
so what
you,
again, my question is, what's the concern with, say, puberty blockers? Because you made a comment that you believed it causes sterility and maybe an inability to I don't know if you equated in a comment in one of your videos that you equated puberty blockers with HRT, which was confusing to me, and then said, "Hey, well, what if this stuff leads to these bad things in kids?" Well,
I can say very generally, my problem with puberty blockers is, and that's why I asked you the question: is your default that we do it as long as there's no evidence that it hurts, or that we don't do it until we have evidence that it's safe? Like, there's two ways to come at this. So my default is
no,
you don't do it until you're very sure it's safe. And I think where you're
that's
coming from is you do it until it's proven to be unsafe.
no.
No?
No. I do know
Okay.
enough about medicine to know this. So if my doctor would prefer, let's just give an example. My doctor would prefer it if I didn't have to take blood pressure medication. She would rather I not have to take it, but I do have to take it. So congenital stuff. So if I do have to take it, it comes with a series of side effects that are not great. Now, I might be on a standard one, but let's say that you got a patient that has to take something like a beta blocker and at very high levels. This can create cardiac issues later on. The doctor has to weigh what's the cost of an untreated condition versus the possible and potential side effects of the medication given. That's the trick. So if puberty blockers, there is a possibility that puberty blockers can have these kinds of issues. On obviously, they're having an issue on a body. They were designed for dealing with
Okay, I
precocious
think I understand
puberty.
what you're saying. You're saying that you take medications and they all have side effects, and as long as
Yeah,
the person is willing to accept those side effects, then
that's
that's
done
fine.
under the doctor's care. Yeah,
Yeah.
yeah.
Do you think a child can consent to those side effects?
For puberty blockers,
Yeah.
they're reversible. So yeah, I think they can. In the same way that a child could
So
consent to
consent
say,
is based on whether it's reversible or not.
no, I'm just saying
Okay.
in this
Why
case,
can't?
it doesn't seem like the stakes are that high.
Because Dr. Ben was saying, and maybe you disagree with Dr. Ben, but he was saying that a teenager cannot consent
To
to
puberty blockers?
to bottom surgery.
No, they can't.
They can
But
or
can they
can't?
cons they can't. Can they consent to puberty
Okay,
blockers?
why can't they consent to bottom surgery, but they can consent to puberty blockers?
Because puberty blockers are a milder, less invasive form of treatment, and
So
they're
yeah, that's what
reversible.
I asked you. So it's basically the severity of the side effects which determines consent.
It's the level of invasiveness.
Interesting.
To what extent, if I have a stomach ache, I don't automatically go to the ER and demand to have my appendix out because I'm convinced that's what's bothering me. They're going to be like, well, wait, have you tried taking a Tums? Right? You don't jump to that part. It might be the case that I need to have my appendix removed, but that's not indicated just because I'm having these symptoms. And that happens even with trans people, especially if they're dealing with dysphoria. That would indicate you're dealing with dysphoria. Maybe you need to be on puberty blockers if therapy alone is not enough. If an antidepressant alone or anti-anxiety alone isn't enough, maybe a puberty blocker is beneficial in this case. It'll prolong the onset of secondary sex characteristics long enough to do more therapy with the doc, prevent any complications, and then you revisit and go from there. But
See,
it's all touch and go. It's all got to be done in consultation with the physicians and the patient and the patient's guardians in this case if they're minors.
like I always give the example of my son is pretty skinny, and he's somewhat sad about it, and he's getting bigger as he gets older. But if let's say 2 years ago when he was really sad about it, he said, "I want to be on steroids. I can't.
Hmm.
I'm eating and I'm eating and I can't gain weight, and I look in the mirror and I just see this scrawny boy, and that's not who I am. I view myself as a strong boy, not a scrawny boy." And so I take him
Okay.
to the doctor, and the doctor prescribes him steroids because of this dysphoria, whatever he has, whatever you call it. Do you think, would
It'd
you
be
support that?
it depends. I mean, just on the hypothetical that you've given, I would need more info. That's not a
What
that's
more
not a great
info?
comparison.
What more info would you need?
Well, first of all, does he actually have I mean, kids do get prescribed HRT in some cases for non-trans related issues. So
Yeah,
does he have an
I'm
issue
giving you
like an
one.
undescended testicle?
No,
Precocious
no, no.
puberty. Those are
In
indications.
his mind, he sees himself as a strong boy with muscles, but he looks
Uh,
in the mirror and he doesn't see that. He sees a scrawny, skinny boy, and he's asking to be put on steroids to gain muscle. Do you support that?
Probably not. But again, it would
Why
depend on the
not?
doc. It would depend on the doctor. It would depend on the care.
So you would just go with whatever what the doctor said. So if the doctor said, "Here's steroids for your son,"
Well, in this case, that's a little bit misleading because he'd be the only doctor being like, "Yeah, your 16-year-old kid needs some Deca. Here we go." Just
what if two doctors said, "Here's steroids for your son"?
that might be indicated in this case. I don't know.
So I'm not hearing an answer. You would say yes, go for it as long as two doctors say yes?
If doctors believed that was the healthiest course of treatment for your son, I'd be inclined to agree with them. Yeah.
Okay, hang on. What do you think would be the criteria for health in this situation? Like
Uh,
let's say we denied my son the steroids.
they would be weighing the cost. They'd be weighing the cost. It'd be a cost benefit analysis. They're weighing the potential benefit on your son's mental well-being and health versus the potential side effects of whatever treatment that they're looking at. So
So what if my
if your
son
kid is
threatened suicide if he doesn't get it?
right, like say he's actually distressed about this, and they
Yeah.
decide to put him on some kind of testosterone therapy, maybe that would be beneficial to him. Now, if they decided to put him on some kind of, you know, one of these high test anabolic steroids that could cause, like, you know, irreversible cardiac damage that's not really
But is the
regulated and
threat of
actually
suicide
illegal.
would be the determining factor?
I don't know if it would be the determining factor, but it is a factor for his care.
Right.
Why do you always have like a really binary approach to this? Like,
Well, no, no,
I want to
no.
see a metric that kicks here, it ticks a box, and then the machine spits out the drug or the
What I'm
recommendation.
getting
Like,
at here, Jefferson, is do we give children
yeah,
drugs because they want it to feel better?
no,
No.
no.
You sure?
Yes, the doctor is giving those drugs to them to improve their health and their lifespan.
Whoa, hang on. Stop there. Isn't
Yeah,
feeling better part of your health?
it can be. But again,
See,
you're weighing that, we're weighing that against the cost of the treatment. If if I went to a doctor and said, "I'm really sad, doc," you know what would perk me right up? A fifth of Jack Daniels and some heroin. They're not going to recommend that because the cost of taking all those drugs is obviously harmful compared to the fact that I feel
obviously
really
harmful.
statistically tested and harmful. Yeah, an almost lethal amount of heroin and a ton of alcohol. I mean, there's plenty of evidence to back that up. There isn't the equivalent information to show that this kid has some kind of, we'll stick with your son. Your son is feeling depressed, he's underweight, undermuscular, maybe he feels fatigued quite a bit. Maybe he would benefit from that hormone therapy. That's not the equivalent of saying, my kid wants all the steroids so he can turn into Captain America. The doc's going to be like, that's not a thing. I can't do that. But what we can do is possibly look at some hormonal therapies that might benefit you in the short term to hopefully get you over this hump and help you
Why
feel better.
not? I think we're agreed that maybe just tell my son, wait, keep working out, keep eating, and if you're sad about being skinny, we got people you can talk to.
That's also part of the therapy, Doug.
Yeah, so we're agreed on
Right.
that one.
But that's what happens to the trans kid. They
Okay,
spend their time
yes,
talking
but
to a
where's the trigger switched when it comes to? I think we got to give him steroids now.
when they don't respond to the therapy.
Okay, what does that mean? Don't respond.
It depends on the patient. You'd have
Give
to.
me some examples.
I'm not a shrink, so I wouldn't know. But you'd actually have to get to a point where if you've got a 2-year
I
course of
think I know. It's the sadness level goes up and the risk of suicide goes up.
that can be one of the factors. Yeah.
And this is the problem with this whole trans issue. Because
Why?
what we're end up doing is everything is self-reported. Right?
It's not self-reported. They're working with a doctor.
Are
Technically,
you sad is a self-reported thing.
until your doctor.
A doctor can't verify if you're sad or not.
Yeah, they can.
How?
Okay. Let's say that you actually have the physiological symptoms of depression.
Okay.
Then they can evaluate, like, this
Give me
person
one.
says.
Give me one symptom of depression.
Let's see. On the really negative side, job loss, lack of interest in sex, lack of interest in socialization, withdrawal from society,
I
weight
could pay an
gain,
actor to do all that.
and it could be verified to be fake.
Yeah. What? How? How?
No, you could pay an actor to
This gets back to
tell
my
them.
question about 10 people and one is the real one, nine's the fake.
You could pay them to do that one time and go and talk to a doc. Like, they're not showing up for a Dr. Pepper. They don't go in and be like,
I
hey, I'm
know.
super depressed, gimme. Like, they would
Over
actually
time, it's
work
harder to
with their.
fake it for a long period of time. I understand. I agree with
Right.
you. I agree with you. I agree with you.
So
But
why
my
is
point is that the basis of all of this, with my son, with this feeling of I am a big, strong guy, I look in the mirror, this is a type of dysmorphia dysphoria that I think can be easily solved through waiting and more talking.
right?
That we should not put drugs in my son. Okay. Now, maybe.
Maybe
In what cases would you put drugs in my son?
it would depend on the doctor and
Can
what
you
your
know?
kid's going through.
Give me
Right?
an example.
Let's say that your kid actually has some kind of testosterone deficiency. He
Let's say he
feels
does.
this.
Okay, he doesn't. He doesn't.
Okay. then he'd probably, the recommendation would be, if the physiological tests come back and it's not shown that there's any kind of deficiencies, therapy. And then as the therapy progresses and time goes by, maybe he does
Hang
start
on,
to
would you
put on
just
some
say
healthy lifestyle.
no physical deficiency, so therefore therapy, right?
Yeah.
What's the physical deficiencies that we can measure in a test tube for trans?
Well, that you can actually test for sex hormones like low T and high estrogen, but I don't
Oh, so
know.
you would withhold therapy for trans people if they have normal T levels and normal estrogen levels?
When did I say that? I would say that they need therapy for that. I just wouldn't shoot for drugs.
Right, that's
That's
what I'm
what we
talking about.
settled on, right? So that they would get recommended. What do trans people get recommended to do first? Therapy.
Therapy,
What
yeah.
would your son be
Talking,
recommended to do first? Therapy.
talking.
Talking.
Yeah.
In your son's case, more than likely, as time progresses, let's say he's not allowed to do anything with any kind of T supplements until he's done 2 years of
But
therapy.
you said
Turns out
with
he's
my son, you would
your son,
recommend an example of recommendation of steroids
right?
would be if his testosterone was low.
Possibly, yes, that could be one example.
Yeah.
That there's something mental and
Something
physiological
that's
going
not
on.
subjective. We can measure that in a test tube.
Well, low T wouldn't be, yeah, it would be objective in that sense,
Yep.
but that also could
No
be
matter if
something
you're
that,
Republican or Democrat, you agree the
but
testosterone.
he's young, and those hormone levels could improve over time. So
Yeah,
it would
so
depend on what was
probably should
monitored.
wait, right?
How long? Because trans kids have to wait like 2 years. Most trans people have to wait 2 years of therapy. If your son doesn't improve in a year, maybe the doctor's like, yeah, I think something's going on here. Maybe you would benefit from some kind of testosterone supplement. We
Okay.
do this all the time for 50-year-old guys. I don't know why this is the example you're using. I could go to my doctor right now and be like,
The
hey,
difference is
I'm feeling a little less manly. Gimme.
the difference is that what we were talking about earlier about the whole idea of consent and the idea that kids are often confused.
Sure.
They're often under peer
Again,
pressure.
that's why there's the therapy.
They're often sad because of
But the peer
hormones.
pressure in most cases in trans in this country goes the other way.
Which way?
What's influencing them, for the most part? Coming out as trans is a net loss, socially, emotionally, sometimes
I'm
even
going
with
to
your
pull
peer.
a
It could
line
be
from.
dangerous,
I'm going to pull a line from you. It can be, but it can also cannot be.
but it statistically is. It statistically is. I mean, it's gotten better, but it's statistically been a dangerous thing to actually discuss with people. You could get attacked.
I found it interesting when I was listening to of my interaction with Ben, Dr. Ben, as he said that he talked about the process of counseling first and everything. But the
Yeah.
first thing he said, and everybody can go back and rewind it and make sure I'm representing them correctly, but was that the child, the teenager, step one is they present themselves as trans.
Mm-hmm.
That was step one. And the first thought I had, and I couldn't talk because
You're talking about social transitioning.
Well, what I'm talking about is he said that, and maybe he just misspoke, but he said that before even talking about going to a therapist and finding out if they're trans. It was no. The kid actually makes a self-diagnosis of I'm trans, and then they go to the doctor.
They're not diagnosing themselves. They believe that they are that way. Yeah, that's how they identify, and that can often happen. I
So
think
can someone say they're trans and not be trans?
well, that gets into something kind of tricky, something that I'm not entirely sure about. I tend to think that there might be something kind of biological maybe going on with some of this, because
It's a hypothetical type question. I don't think it's a trick question.
I don't think it is either.
Can someone say they're trans and
Right.
be mistaken?
It depends on what you mean by trans. It depends on the definition of it, right? So if there's something going on in the brain where, and they know this from like 3 to 5-year-olds, that's usually when they start kind of recognizing, yeah, I'm not this, I don't feel like the pieces that I've got. That might be something different than somebody self-identifying as what they feel.
But if trans is defined as a mismatch between gender and sex, if someone says they're trans, can they be mistaken?
I don't really think that they can in terms of just the gender role. No, I think you might be getting this conflated with like a sex change. In terms of if gender is just a social construct, then a person can be trans just by, I mean, do you believe that a person can be more masculine or more feminine based on clothes they wear or hobbies they have?
They present themselves as more masculine, yeah, or
Okay.
feminine, yeah.
So in that case, then that gender in that case probably is more of just a social
But
construct.
what I'm getting at here, Jefferson, is that if someone cannot be mistaken about being trans, having this mismatch, then really they're not going to see a therapist to find out if they're trans. It's more just dealing with the repercussions of being trans.
I think it's to determine whether or not that's because I don't know if they, I think somebody could decide that they're trans or they could feel like they are that way, but that might not be the full extent of what's going on with them because you do have after
Right.
therapy some people coming out as being gender queer or gender fluid. They're just not, they're non-binary. They just don't accept that. They don't take a position on it. They don't think that there's any point. I think they represent kind of the minority in terms of like, of the group. But no, I don't think generally. Generally, if you're dealing with somebody who's saying that they identify as the gender opposite of their birth sex, they are trans. The question is whether or not they're willing to start the process of beginning the transition of presenting themselves that way. It's one thing for them to present to a doctor in consultation in private. It's another thing for them to do the social conversion part. They maybe they change their pronouns, maybe they change their name, start growing their hair long if they're a guy, going to a girl, if they're a girl going to a guy, they're taking more steps, or maybe none at all. Maybe they don't do any of these things. And it can happen in a pattern. So it can happen on an arc.
Do you think trans people commit suicide at higher rates than the normal population?
I mean, based on some of the studies that I've seen, it seems like that group is more prone to it. Yeah. I think those rates are going to start going down.
Because I'm not so sure that even that's true. You know why I say that?
Why?
Because if you read the studies, and you can try this after we're done talking, find data on actual suicides, like where kids are actually now dead. You can't find it. You cannot. Think about Jefferson. Think about the papers you've read on this topic. It's always suicide risk, suicide ideation, and suicide attempts.
Okay. So what's wrong with that?
Nothing's wrong with that. All I'm saying is we don't even have actual data, or at least in the United States, we don't have actual, real data that trans kids commit suicide at higher rates than the average population. It's always risk, ideation, and attempts.
Are you talking about trans kids or all trans?
Oh, sorry, all trans.
I think there is better data to suggest.
If you have it, please send it to me. You can, you know my email, because
I'll
I've
try to
had
find
this.
it.
I've had this challenge to a lot of people, and they raise, oh, Doug, you're full of it, and then they actually started looking into it for themselves, and they go, you're right.
But I would also wonder too, like if you're a doctor, and I'm thinking I keep thinking about this issue from the position of like what would a doctor probably be doing in the scope of their job. If you're dealing with somebody like, okay, well, I got to do something about this person because lots of people in their particular group that they identify with have killed themselves, or I need to do something for this kid because they've already opened their wrists twice.
Yeah, I'm not saying that's good. That's bad. I mean, of course, we don't want kids slitting
You
their
would agree
wrists.
that suicide ideation, suicide attempts are up in that group. Would you contest that?
Yes. No, I wouldn't contest it.
Okay.
Yeah.
So that's bad enough as far as I'm concerned.
Yeah, but what I'm pointing at is this this whole idea: would you rather have an alive daughter or a dead son? This type of rhetoric, which exists, I've heard it with my own ears.
Yeah.
And the thing is, we don't have data that that's actually happening. Now, attempts, I agree with you, it's terrible. But there's people who cut themselves for a variety of reasons. Not just being trans, and so
Right, but
this whole idea that any type of trans therapy, whatever it might be, reduces the risk of suicide. For me to actually believe that, I would need to know the actual suicides pre-transition or no transition.
Why? When we've already got the
Because I value evidence.
but we have the attempts as well.
No, but if the claim is it will reduce actual suicides, not just attempts,
Oh,
but if
I don't
that's the
know.
claim, because remember what I said, would you rather have a dead son or a live daughter? That's the rhetoric, right? If you want to counter that rhetoric and have a guy like me on board say, yes, I agree, we need evidence of actual suicides, let's say per thousand, per 10,000, whatever, before transition, actual suicides after. And I'm pretty confident when I say this, that evidence does not exist.
Okay, well, I found one here. Danish study finds
Yeah, I found that one too. But I'm talking about in the United States.
because there's two ways of looking at it, right? Sorry to interrupt, but I mean, one is to say that there's a rate of suicide higher for transgenders. The other one would be calculating whether or not their risk is higher for suicide, and you would base that on reported distress levels, attempts, reports of suicidal ideation. Those are all going to, like,
But
you could say that, like, well, you know what, depressed people have a higher rate of suicide. Well, yeah, but how many depressed people have actually done the deed?
yeah,
How many are actually dropped dead? Well, for treatment, you're going to be basing it on, well, the people who are sad, reporting to be depressed, and are at a higher risk for actually completing the job if they've attempted it once or twice, or are constantly thinking about it, done other things to self-harm. Their lives are falling apart in other ways. There's a lot of other components in this other than, because what would happen if that happened? So you're saying that you're going to change your views if you find out there truly is like a death toll for trans people? You're not, now you're going to care?
now I'm saying that
If
if you
if I
want
f-
to,
if I found you a study that showed, yeah, one, they do have a higher risk rate. They actually have a higher rate. There's more people dead of suicide who were trans.
Mhm.
You would be,
I would care more.
you would.
Yeah,
Okay.
more.
But
Just
what
just like you care more about bottom surgery over top surgery because it's a bigger consequence.
I'm concerned about the fact that the risk rate, the people that are attempting and doing the ideation thing,
Yeah.
is so much lower, I think, for you
What's
than
the
the
risk,
fact that
Jefferson? What's the risk of you getting hit by lightning? Very low, right?
it's very low.
Okay. In general, it's very low. What's the risk of you going out in a lightning storm holding an umbrella, of getting hit by lightning?
Intentionally?
No, no, you're just going out. You're not, you're not reaching the sky, but you go out in a storm. The risk goes up, right?
A little bit, yeah.
Yeah. But guess what? Your risk of getting hit by lightning is still very, very, very low. And this is what I think is happening with this, with the suicide type rhetoric. They're saying, yes, these types of medications or surgeries or counseling will lower the risk of suicide. Granted, but even if we go to actual suicide, it's still the chances, the rates of actual suicide are still incredibly low. Like if you want to talk about actual suicides in this country, it's middle-aged white men. They know how to commit suicide and they do it very well.
Yeah, that's
Trans
where
kids are horrible at committing suicide. And so this whole rhetoric of you either got to
actually
do this or
the
we're going to
reason
kill ourselves
the
is
reason
emotional manipulation.
really,
That's how I view it. Yeah. It's a type it. Oh, no, hang on. Let me do what you did. It can be.
it sounds like you're definitely yeah, this is my problem. So if I'm a doctor and I've got a person, I'm not going to wait until they're dead. And the other issue too, if I'm providing them care and they still open their wrists, I'm probably going to get sued by their caregivers, their parents, or guardians as for malpractice. Like, why couldn't you have done more for
Do
our son or
you
daughter?
agree that telling a doctor telling a parent that asking a parent, would you rather have a dead son or a live daughter? Would you agree that's emotional manipulation?
It I don't think a doctor wouldn't say that to a patient. To they now if
If a doctor said that to a parent, would you rather have a live son or a dead daughter?
I think that would be an inappropriate thing for them to say
Would
because
you
it's kind of
agree that's
outside the,
emotional manipulation?
probably, yeah,
Yeah, okay, we're agreed.
yeah, coming from a professional.
Yeah.
Yeah, I think it might only be a little bit hyperbolic if it
Well,
was coming from an
even if
activist who has friends that
even
killed
coming from
themselves.
a non-professional, that's emotional manipulation.
Not, yeah, but is emotional manipulation always a bad thing if you're trying to make a point? If you're talking to an
No,
activist that lost 5 trans friends because when they came out, their
no, I agree
parents or
with
the
you. It's
family
not always a
bullied them.
bad thing, but I just want
Okay,
to call it what it is. Now you
but you
compound.
didn't call it what it is. Depending on the
But when
circumstances,
you
it might
compound
be a
that
good
to that, we
thing.
don't actually have actual evidence of suicides of trans people in the United States. I agree with you. There's that one Danish study, and I think there was also one out of India. You're going to find it later when you look. But we do not have data on, like, if I was to ask you this question, let's say God's in the room and he knows the right answer. If you were to guess, how many trans people committed suicide last year because they were trans? What would be your guess?
Oh, are you asking me?
Yeah.
I, why would it matter?
Can you guess?
No,
I want to know what your intuitions are.
I wouldn't have any intuitions on it because I don't
Okay,
know.
what if I told you it was 1 billion? You would definitely say no, right?
That would be too high. That would
How
be
what about 1 million?
that also seems a bit high given
How about 100,000?
maybe. Who knows?
Really? How many suicides were in the United States altogether last year in the United
That's
States?
that's why I can't give you an intuitive answer. I don't know. I don't know what the rate is
Yeah, you know what my guess is? My intuitions?
for everybody or for
In the
trans.
United States, trans only. You know what my intuitions are?
What?
40, maybe 50.
Oh, based on what? Just your intuition?
Uh, I can go through it, but basically, I looked at the suicide by demographics in the United States, and I think the year was 2020. And so, I you can make inferences, and basically, it's very low. In fact, I've confirmed this with some other people. Not confirmed, that's the wrong word, but I asked other people and their intuitions on this. Most people, I think, have in their head, like when I said 100,000 to you, that's where you said definitely no with a billion, definitely no with a million. But when I
What?
got to 100,000, I could tell, okay, now we're getting the ballpark. But
Yeah,
I'm
because I
saying
don't know.
that's way overstated.
So what is the total? What is the total number?
We don't know the actual. Like this
No,
is
of people, of
with people in the
Americans.
United States. I forget
Yeah.
what it is. I think it was uh, what was it, 9,000? I forget what it was. I know there's 22,000 murders. No, maybe
That's not bad.
14 per 100,000 individuals. Why do they always do it that way? 350 million.
In 2020, it was 45,900.
Yeah, that sounds right.
Yeah.
Double
Okay.
murders. 45,000.
Yeah. So you're saying that it would only be, but here's my
Okay,
problem.
okay, hang on. 45,000. What percentage of the
Why,
general population are trans?
why is that important to you in this discussion?
Because it gets to this whole emotional manipulation thing, and
Why is that again? I don't. Why is that a problem? If it's a problem from some
because it's not
perspectives.
following the evidence. It's using emotions to get what you want instead of following the evidence. That's why it's a problem.
Okay, so let's say that you don't have somebody using that language, and their concern is not about the fact that they might successfully kill themselves. They
I
are
respect those
hurting.
people more.
They're hurting. They're desperate, and they have attempted to they're self-harmed. In that case, okay, so the therapy. So I think we're way off track here. If you're trying to figure out like, hey, you guys don't have a leg to stand on, not that many trans people off themselves. That's a really callous position to take when you're trying to figure out like, I mean, that's the ultimate, that's the extent of like a lack of care and a lack of help for those people. Well, only 40 or 50 died, so it can't be that bad. It could still be bad.
Sure, yeah. But if
So
you're actually concerned about
this
actual
just seems,
suicides, you
but
sh-
I'm not concerned about actual successful suicides. I'm concerned about the level of harm. And that's what the doctors are concerned about
what
too.
more harm is there than suicide? I mean, actual
Well,
suicide.
you're
They're not going to
jumping
live anymore.
you're jumping to the extreme one and saying, oh, there's only 40 or 50, as opposed how many attempted because they were trans. The doctors are looking at that level of self-harm too. What can they do about that?
Yeah, but
If they successfully kill themselves, the docs are out of out of options at that point.
to me that's
So
to me that's also very subjective because um, the attempts thing. Like, there's definitely clear cases, right, where someone's
yeah,
trying to cut a major artery,
right.
but there are many other cases where I can see kids, teenagers, um, trying to commit suicide, but not really, to get attention.
Right.
You know, like going in the garage, starting the car, but the garage is an old garage full of holes, and they stop the car, and then the parents come in and go, oh my goodness, and it's like they make a big deal out of it, which is a big deal, but let's be honest, odds are they were not going to go through with it. Really didn't think it through because there's a big gaping hole in the garage door, and yeah, they would have got a little sick, but they're not going to die.
Okay.
So there are.
So would it make you feel
the
better
best way to get attention as a teenager is to use this type of emotional manipulation.
and the best way to continue to like screw with that kid is to make that conclusion yourself and not get them help? Would you just tell your
No,
kid the
no,
best
I'm
way
not
to
saying you don't get them help,
Okay, but let's say that this happens.
but I'm saying that the help should be in the form of talking and counseling. And so,
Agreed.
yeah, and I know we're agreed
Agreed.
here, but the thing is that the reason why we're even talking about the suicide rates is because of my opening statement, when some people have this idea that this is so important because lives are at stake. They are more likely to commit suicide, and that by doing certain procedures, we can lower the number of suicides. When they talk this way, this is what I'm combating against, because A, we don't know the actual suicides. B, even if we did, we don't have data on suicides pre-transitioning, suicides post-transitioning. We definitely don't have it over 10, 20, 30 years. There's so much we do not
But
know.
again, though, like I don't understand why you're like the suicide rate is not where I like hang my hat. I don't.
Yeah, I'm not talking
That's
about
not
you
the linchpin.
specifically.
Yeah, but the thing that you said there, oh, they're going to hurt themselves, they're going to harm them, then they're going to kill themselves. There's two differences there. If you're talking about whether or not like, hey, this isn't really that big of an issue, let's continue. Like society is going to make fun of these people if they're trans, whatever. Some states are going to pass laws telling them they can't get gender affirming care, which, believe it or not, does include therapy. They're not going to get it if they're stating that that's what they're there for. So we'll just make their lives really hard, and then hopefully we can get those suicide numbers up, way up, and then that'll justify an excuse to maybe do something about it. The dialogue around this whole thing is completely fucked up. All of it is. And the reason I think that it is because nobody actually, I think in your case too, you do not believe in trans. You just think they're delusional.
No,
And
no.
you've been bringing up examples like a cry for help or emotional
Let me answer like
manipulation
you.
or
It can be, but I'm not saying all trans are delusional and all trans doesn't exist.
what rate do you think they're faking, Doug?
I think the
What
level of regret is probably multiples higher than what people say.
Well, right now it's only at around 1%, and it depends on what you're talking about.
Yeah, I'd say it's closer to 50 and maybe even 80%.
Where are you getting that from?
I can send you 5 different articles, not articles, papers, and so forth after this.
Okay, because as far as I know, it's about 1 to 2% post surgery.
I think that
I don't think that.
I know where you get that from, and like back in the 80s and 90s, there was it was much more stringent to say someone is trans to begin with.
They would just
Now,
insult them.
now, like if in 2023, like if I, in all seriousness, said to you right now, at this moment, I am a woman. Like I'm not joking, Jefferson.
Right.
I'm not joking. I'm a woman.
You identify as a woman. Okay.
If I said that right now, under today's, in a lot of places, in a lot of standard of care places,
Yeah.
they would just accept it. I just said it.
Sure.
Okay, so
Why shouldn't they?
why shouldn't they?
You're not saying that you're biologically female, are you?
No.
You're just saying you're a woman. You identify as a woman.
Yeah, but this
So
gets
what?
to definitions too.
Okay. So what happens next? Do they hand you a scalpel and say, "Hey, lop
But
it off"?
what I'm saying is that years ago, decades ago, that wasn't the case. That
No, decades ago,
you couldn't just self-declare it.
I think you remember this. When I was a kid, there was no such thing as trans because they just talked about sex changes, and then they called them trannies and other
Or yeah,
derisive
or transvestites.
or transvestites, which had
Yeah.
nothing to do with it, right? But Not necessarily, right? Because some transvestite is just drag. Um,
Yeah.
but the sex change thing was always the thing. So it was always caught up
But that's a good
in
question. I'm glad you brought this up.
it was always caught up in sex.
How would you tell the difference between a trans person and a transvestite?
I don't know that it's important. It would depend on
Can
what
you
they
try
told
to
you
answer
there.
my question?
How would I tell the difference?
Yeah.
I would listen to them.
So it's self-declared, right? It's just
Yeah.
it's
You could
just
have a you're right, you can have a
speak
drag
it
queen
into
that
existence.
you can have a drag queen that is obviously male and identifies as a man,
So
but
you can
they
have a
perform like
guy who likes to wear women's clothing and not be
yeah,
trans. You can be a guy who likes to wear guys' clothing and be
and be
trans.
trans. Yeah.
Yeah. And you can, I mean,
We do this already, Doug. You can have a sister that wears overalls and lifts weights and works on cars
and
and
not be
still loves
trans.
men and not and
Yeah.
or be trans. She could identify
So
as a
how do
man.
you know if someone's
Or
trans or just a butch girl?
well, I guess I mean if this is a cause for concern, do you think that we should just like get them armbands or something? Like I would listen to them.
So just by
Are
what they
you
tell
concerned
you
about
so,
getting
right?
are you concerned about traps?
Yes,
Why?
because it's not based on evidence, objective evidence.
You
So
know what wait, you know what a trap is?
deception,
No.
or what are you talking about?
You don't. So let's say that traps, the kind of this is kind of replacing trial.
TRAPS?
TRAPS, yeah. So you're a guy and you're straight and you're at a bar and you start hitting on a woman that you find attractive and it turns out she's a pre-operative male, identifies as a woman, she's a trans woman,
Mm-hmm.
and then the guy is offended by this. He's been
Well, I'm not
tricked.
personally worried about that.
I just wondered if you were, because
No,
it seems
no.
because it seems like you're asking this question like, well, hey, how do we tell which one's which? I don't care.
But what I'm pointing out to, you're an atheist, right?
Yeah.
Yeah. Um, I just had a guy on earlier who talked about having a personal relationship with Jesus.
Okay.
And I asked him, "How do you know?" Because I feel it. Yeah,
Yeah.
but you could be mistaken. Like, is it possible for you to feel like you have a personal relationship with God, but you don't? He said, "No, that's not possible."
Yeah.
Guess what? That sounds like the trans conversation we're having. How do you know you're trans? I feel it.
Don't you have to do that with? But I mean, I wouldn't deny somebody who, as
How
an
do I
atheist,
know I'm 52? I can actually demonstrate it, provide
can you?
evidence. How do I know I am a biological male? I can demonstrate it. I can show you, but I
Sure.
won't.
You can
How do
demonstrate
you know
that
you're trans? You feel
could.
it. How do
Oh,
you know
and
you got the power of the Holy Spirit in you and the inner testimony of the Holy Spirit? I feel it. You see the similarities?
But you know what? But do you know where I'm not on board with this? I
What?
wouldn't deny that person their feelings. If they say that they feel that they've experienced God, I believe them. I just don't think that what they experienced
Hang
was
on a second.
precisely God, but I think that they
Well,
feel
well,
it. The
is-
feeling's real.
okay, the feeling's real, but you would
Yeah.
say what?
I don't know that it's based on what they think it's based on.
Okay, would you say that to a trans person and be consistent?
Yeah. If that's the point of the therapy,
So
just
you would look
to
at a
make sure.
trans person and say, "I know you. I believe that you're feeling what you're feeling, but you're
But
not really a boy if it's a girl." You would say
no,
that?
no,
Why not?
because in the same way that I wouldn't tell the believer that they're not really a Christian.
Okay, but why wouldn't you say
They're
that to
really.
why wouldn't you say that to the Christian?
Why wouldn't I say what to the Christian?
You said that you would believe their experience, but wouldn't believe their attribution, right? For the
Right.
Christian.
Right.
Why wouldn't you do that with the trans person?
Because in the case of again, it would depend on the religion that they're trying to present me with. I'd be like, well, I'm not really convinced that something like that exists, but I can't deny your feelings. In the case of somebody who's coming out as trans and they're saying this is what I am, I might have my own doubts depending on whether or not I know them or not. But that's between them and their doctor to work that out. I can't be the final
Well, let's
arbiter
talk
of
about
that.
this for a second. You don't believe God exists, but you do believe some people claim to have experiences of God and just misattribute it.
Maybe misattribute.
Why
Yeah,
do you believe trans people exist? And it's not just a misattribution.
because they do. Because if gender is just a social construct, then they exist. They identify as they're a male, but they identify as a woman, or a female that identifies as a man.
So
Or
it
maybe
only
they're
exists as
non-binary.
a construct.
I think it only exists as something psychological and maybe a social
Okay,
construct,
so you would
some
say
combination of the two.
being trans is like God existing, but only in your head.
Yeah, kind of like an ontological God,
Okay, I agree with you there.
possibly. But that again, that's gender, not trans. All gender would. The fact that you're a man is the same thing. You're laboring under the same mental
What?
process.
Being a man? Oh, hang on. Say that again. Being a
If
biological
gender,
man?
if gender is a social construct, no, not being a biological
Okay.
male,
Okay. Good.
being a man, the gender man, that would be the same social construct, even if you are cishet, or in this
Yeah.
case, just
I
biologically
actually
male.
think we
It
should get
matters.
rid of the word gender. To me, it's just it's
You,
stereotypes and
you,
personality types.
you can't.
You can or can't.
Conservatives won't let us.
I'm a conservative. And I will let you.
So you would get rid of the all-American man kind of image too? Like
No,
that's
no.
a
I
real
said
man because he
gender.
right.
The term
That's what I'm
gender.
talking about. So
Yeah.
okay, so here's the thing. So if you got a man, a male
Yeah.
who wears drag,
Yeah.
right? What if you have a guy not really feeling it, dresses up like a construction worker to impress people? That's gender performance, right? Would you
Yeah.
agree with that?
Stereotypes and personality types. Yeah.
Right. So that's
That's what I'm
gender
saying.
performance. Yeah. And
But
it's based on social assumptions, social constructs, and psychological.
yeah, and I agree with that. But all I'm
Yeah,
saying is we should be more specific with our language instead of using like this two-syllable word gender. Call it
you
more
can't.
specific.
The problem is that if as long as you have a group of people that refuse to acknowledge that there's a distinction between sex and gender, you can't eliminate gender and then just be like, you've got a dick and you've got a vagina. That's not how it's going to work. It won't, because that just completely reduces it. And then you can be like, oh, well, it's simpler now. We've just labeled it to you are a white middle-aged person with male genitals and sperm, unless you've been fixed.
But I want to get into sports for a bit, and then I got to stop because I've been going like for close to 4 hours now.
Well, I do need to get going because I got to be.
Oh, you got to go now?
Yeah, I got to go pick up something before they close, and they close at about 7, so I got to hightail it.
Okay, before you go, and I won't push back, I just want to know do you support trans women in all women's sports?
Yeah, for the most part.
Okay.
But I don't really have a dog in that fight because I hate sports. So the wrangling over who gets what and who gets
Most
the
trans
sport,
activists hate sports too. I found that out.
not the ones performing the sports. For them, it's
They
a
never
huge
did
deal,
competition in high school.
just for me, it doesn't seem like. It seems to me like a lot of the recommendations are being made on false assumptions and weird logic. But
Yeah. Okay. Well, thanks for hopping in. Thanks for the civil dialogue. I appreciate you. I'd rather have this than what happened with the line. I mean, this is so much better.
well, again, I would suggest if you ever do call into them again, the best way to get over that is that your concern for kids is about them getting care from potentially doctors performing medicine in bad faith, and Arden and Ben aren't looking at it that way. That was your first disconnect, and that's why they were getting triggered, because they felt like you were dodging that, and you were, because you were just like point of agreement here. We're both concerned about kids, right? They're concerned about whether or not kids who are transgender can get access to care. Your concern is a little bit more deranged because it's based on
You can't
narratives that,
leave on that note. That's
sure I can.
not.
I'm not saying you're deranged. I'm saying the narrative that informs a lot of the conclusions you're making, I think, is a deranged one, because it's based on concerns that these kids are going to get more invasive and bad faith medical treatment.
No, I totally understand. It's very,
There's
very
no evidence
rare.
to suggest that. So
I totally understand that it's very, very rare, but I support legislation until we have good evidence that and I said what good evidence would be. We should make a law as saying it should not happen. And I think Ben agrees with me.
I don't think that legislation should be done that way, which is weird because I'm a big state guy. I'm a left-wing guy, but I don't think based on the kind of country that we have, we should be passing legislation like that, because it'll overreach into things and create. I mean, look at the 10-year-old girl that needed her pregnancy terminated in Ohio.
I understand.
That's the kind of thing that I worry about, and that happens too often with legislation that's passed like that, because it's passed out of emotion. Because the medicine isn't there yet, the evidence isn't there. There's no reason to pass a law against something that's not really going on.
Yeah.
They're not getting bottom surgery. So
Well, mostly.
Yeah. Anyway, I got to get going. I got to grab this thing. So, but
See ya.
thanks for having me on. It was a good conversation, and yeah, take care.